And the final part, we're going to look at a problem which has become a huge health problem and is going to continue to be a huge health problem, and therefore you should know about the pharmacological aspects of that health problem, and that is obesity. So what is obesity? Well, I'm sure you already know. In fact, I'm sure there's a lot that we're going to talk about here that you will already be familiar with, unless you've been hiding under a rock for the last few years. Obesity is being too fat. And in order to have the label obese applied to you, you have to be a lot too fat. So we have a definition of obesity. Now, as this picture of famous people indicates, if you just use weight as an indication of whether somebody is obese or not, you are going to be very misled, because obviously how tall you are will determine what your healthy weight should be. So yet again, we need to use BMI or body mass index to give us an indication of why somebody weighs what they weigh. And we've looked at this before in connection with the cardiovascular risks when we were doing the cardiovascular drugs, and you've calculated BMI. So BMI basically takes into account both your weight and your height. So it's your weight divided by the square of your height. And so it takes into account the fact that you'd expect a taller person to weigh more. And by the same token, if two people who are of similar heights have substantially different weights, then you would expect that the reason for that substantial difference in weight would be the difference in body fat. And you can see that if you look at Tom Cruise, for example, who's 5'7", and whoever that is next to him who's 5'6". Although they're roughly equivalent heights, you can see just by looking at them that they're probably not the same weight, because the guy next to Tom Cruise has carrying significantly more body fat, and therefore you would expect that the difference in BMI would reflect the difference in body weight. BMI doesn't always work. It usually falls down with children, because children have different body proportions to adults, and it also falls down with people who have pronounced muscular development, and therefore a significant amount of their body mass is due to muscle mass. You might calculate a BMI that suggests that they're overweight, and in fact they're just extremely muscular. But it isn't really that confusing, because nobody has any difficulty visually detecting the difference between a muscular person and a fat person. But for the rest of us normal mortals, BMI is a very good indicator of whether you are a healthy weight or whether you're carrying too much body fat, and if so, how much additional body fat you're carrying. And since it's very easy to find out your height and your weight, it's a very quick and easy measure to let us all know whether we're within our healthy weight range. Okay, so we've got this person here and this person here, the same people in different states. So let's have a look at the slim guy and calculate his BMI. So since they're both the same person, they will be both the same height, 1.8 meters, let's say. So he's 1.8 meters high. If we square 1.8, in other words multiply it by itself, we get 3.24. So the square of his height is 3.24. Now, when he's in his trim phase over here, let's say he weighs 70 kilos. So his BMI will therefore be 70 divided by 3.24, which is 21. Let's compare that with before he went on the diet, and let's say he was at 110 kilos then. His BMI will then be 110 divided by 3.24, which is 34. So same height, but very different BMIs as the body fat goes on. And here are some diagrams to help us recognize that, because the funny thing about obesity, or the unusual thing about obesity, is that unlike many health problems, you can see it, and we're all fairly adept at spotting body fat on ourselves. We're perhaps less adept at spotting it on ourselves than we are on other people, but it's not something like high blood pressure that cannot be seen. You can see when you're carrying too much body fat around. So let's have a look at these BMIs and the body shapes. A normal weight would be considered to be a body mass index of between 18.5 and 25, or just under 25, 24.9. So if your body mass index worked out to be 24.9, you'd be just on the borderline of normal weight to being considered overweight. If your BMI is between 25 and just under 30, then you would be considered overweight, sometimes called pre-obese, but you wouldn't actually have earned the label obese. If your BMI moves into 30 or 30 to 35, you're obese, but you're obese class 1. BMI 35 to just under 40, obesity class 2, very obese, and BMI 40 to 50, extremely obese, obesity class 3, or morbidly obese, as it is in this diagram, which has female-looking figures on it. This problem is an increasing problem, and for this reason, 3 classes of obesity have had to be created, because originally there was one, and people have been pushing the boundaries of the amount of body fat that they can accumulate, and we're having to widen our definition of obesity as people become heavier and heavier. Why is this a problem? It's a problem because from the time you start to become overweight, over a healthy weight, you start to accumulate risks to your health. And this is really how these categories have been decided. They've been decided based on how likely it is for you to suffer health effects as a result of fat at these various body mass indices. So here's a world map which is showing us where we've arrived at in terms of the problem of obesity. Now, this is the World Health Organization map, which is indicating males over 18 who have a BMI of at least 30. So that's in the class 1 obesity. So these are not overweight people, these are obese people. And the colours are indicating the percentage of men in those various countries that are classed as obese class 1. The red shading is where you have more than 25% of your males in those countries being classified as obese. And this dark yellow or orangey colour is 15 to 25%, and the pale yellow here is 5 to 15%, and the cream is less than 5%. So let's concentrate on the red areas. It's all developed countries: North America, Great Britain, Australia, New Zealand. Well, it's not all the developed countries, but all of those are developed countries. But then we've got some oddities here. Well, perhaps not so much oddity. This is Saudi Arabia here in the United Arab Emirates. This is Libya. Not sure what's going on there. And this is Czechoslovakia. Not sure what's going on there either. However, the United Kingdom here, in North America and Canada, Australia and New Zealand are not that surprising. They're coming out with those statistics, and these are 2014 statistics. The problem is increasing year on year, as this map from the Centre for Disease Control in the States shows. They have mapped the problem of obesity over a number of years across all of the states of the United States. And you can see in 1990, all states were mapping either white, which indicates no data, it's not much help, but the lighter blue and the mid blue, which was over 10% of people obese, 10 to 14% of people obese. And in 1990, no states had a higher level than 14% obesity. 6 years later, by 1996, a whole load of states have moved up into the 15 to 19% obese category, and no state is lower than 10% obesity in their population. 4 years later, a number of states have moved up into the 20 to 24% obesity levels. Most of the rest are in the 15 to 19% obesity levels, with one state, and I'm afraid I don't know my American state, so I don't know what that is, one state remaining as 10 to 14% obesity. 10 years later, in 2010, there's no blue left on the map, and we've got 2 new categories that have come in. The orange, which is 25 to 29% obesity levels, and the dark red, which is greater than 30% obesity. So more than a third or around about a third of the population would be classified as obese in these states that you can see shown in dark red here. And no state has a percentage of obese people lower than 20%. So not only is it an increasing problem, but it seems to be a rapidly increasing problem. And you will have heard, I'm sure, you'll have had difficulty avoiding hearing that not only is this a worry, but it's a worry because the levels of obesity are dropping to lower and lower ages. It's not only affecting more and more of the adult population, but it's starting to affect more and more of a population of children. And that introduces a new worry about the health risks of obesity if you introduce those health risks at a very early age. So what are the health risks associated with obesity? Well, there are hundreds of them. You don't hear all of them talked about a great deal. And I'm putting this up to open your eyes to it if they weren't already open to it, but not with the view that you should remember all of these, so don't worry about that. So, well, I think most people could point to the cardiovascular system as being at risk when you have obesity. So we know that there's an increased risk of stroke, of coronary problems, so that will lead to myocardial infarction, angina, and cardiac failure, and we know there's an increased risk of hypertension. So most people would probably be able to point to those as all being as risks associated with obesity. But there isn't a body system that is left unaffected by obesity. So if you want to go to the endocrine system, there's a whole range of problems there. We know that type 2 diabetes is very much associated with obesity. Polycystic ovary syndrome is associated with it, and there are other endocrine syndromes which are associated with obesity too. So this list isn't comprehensive by any means. In the gastrointestinal system, we know that things like gallbladder disease, pancreatic problems, liver disease, gastroesophageal reflux, and a number of gastrointestinal cancers are associated very much with obesity. In the renal system, chronic kidney disease, complete kidney failure, kidney cancer, kidney stones, prostate cancer, urinary incontinence, and sexual dysfunction are all associated with obesity. As far as your respiratory system goes, we know obstructive sleep apnea is a problem. A syndrome known as obesity hypoventilation syndrome, where your respiratory rate becomes too low, and asthma are all associated with obesity, and there's more. The musculoskeletal system, of course, takes a pounding if you're carrying around too much weight for any length of time. Osteoarthritis is accelerated and becomes much more severe, particularly in the joints which are bearing the entire weight of the body, like the knees. By the same token, the intervertebral discs are taking a lot more weight, and so there's a lot more disc problems, lower back pain. It's not just the bones that suffer, it's the soft tissue, connective tissue in the musculoskeletal system, so your tendons, your cartilage, your ligaments, and so on. Foot problems, damage to the feet, excessive loads on the bones of the feet, and the soft tissues of the feet are a problem, and just getting around is a problem as you become obese. Reproductive health, well, we've already seen that sexual dysfunction can be a problem, but in females, the menstrual cycle can be messed about, something wicked, by obesity. Young women who are pregnant and who are also obese have a much higher risk pregnancy, miscarriage, and a generally poor outcome from their pregnancy is much more likely, as is difficulty getting pregnant in the first place. We know that if you're obese as a female, you have a higher risk of a number of cancers, including breast cancer, endometrial cancer, and ovarian cancer. And in terms of mental health, of course, we know that being obese is associated with a number of mood disorders, depression, eating disorders, and just a reduced quality of life, a reduced happiness and general satisfaction from being alive. So that's quite a short, truncated list of the things that happen to your systems when you are carrying around way too much fat on your body. And this is a problem that we all share. It isn't a problem that is associated with any particular person. Obesity is a great leveler in that respect. We all are at risk, and we all put on weight, and we all suffer from the same problems if we do put on weight. So this is a society-wide problem, and it's one that we all have to tackle together. This is not something where we can point fingers at each other, because we are all equally vulnerable to this.